What is bladder cancer? What are the treatment options available for bladder cancer? And who is at risk of getting bladder cancer? Hi, I'm Jaimin Bhatt, consultant urological and robotic surgeon at Ross Hall Hospital, part of Circle Health Group. Today, I will be answering some of your most commonly asked questions about bladder cancer and how to treat it. First things first, what is bladder cancer? Bladder cancer occurs when there are unusual cancerous cell changes happening in your bladder. Your bladder is a small hollow organ in your lower abdomen that stores urine until it's time to empty it. Living with bladder cancer can feel scary and uncertain, but many people with bladder cancer go on to receive effective treatments and lead healthy lives. What are the different types of bladder cancer? The most common type of bladder cancer is called transitional cell carcinoma, which starts in the inner lining of your bladder. This type often responds well to treatment, especially if it's caught early. Another type is squamous cell carcinoma, but this is less common. It usually develops in response to long-term irritation or recurrent infections in your bladder. And then there is adenocarcinoma, which is the rarest of the common types. It forms in the mucus secreting cells of your bladder lining. What are the symptoms of bladder cancer? Blood in your urine is often the most noticeable symptom. In most instances, this is painless. While it can be alarming, not all cases of blood in your urine are due to cancer. It could be caused by an infection, kidney stones, or other benign conditions. Needing to urinate more often than usual or a sudden urge to urinate can also be a symptom. But this can also be related to various other issues like urinary tract infections or an overactive bladder. Feeling discomfort or pain while urinating can be a sign of various bladder issues, including infection as well as cancer. You might find it difficult to begin peeing, have a weak urine flow, or find it difficult to empty your bladder completely. Some people with bladder cancer experience pain in their lower back, especially if the cancer has advanced. You might feel pain or pressure in your pelvic region, which can be associated with bladder cancer. Occasionally, blood that you cannot see is detected in your urine testing. If this happens on a recurring basis, your GP may refer you to a specialist. So how is bladder cancer diagnosed? If you pass blood in your urine, an urgent referral to a specialist like myself is necessary. You will be assessed with a focused history and examination, followed by blood and urine tests. You will then be referred for a camera test known as a flexible cystoscopy for an internal bladder inspection. This only takes a couple of minutes and is performed under local anesthesia. Don't worry, you can drive home right after this test. It's easier than going to the dentist. Most people with blood in their urine will also be referred to radiology for a scan. How is bladder cancer treated? If the camera test detects a growth in your bladder, your surgeon will arrange for surgery to remove this growth by an endoscopic procedure known as transurethral resection of bladder tumor, or TURBT. This is performed under a short general anesthetic or a spinal anesthetic. This procedure not only confirms the diagnosis, but will provide further information on the type of cancer, the grade, which is how angry the cells look, and the local stage, which is how far it has spread within the bladder. This information will help in deciding whether further treatment is needed. Most people are able to go home from hospital the next day, and your surgeon will see you after a few weeks to discuss the results and the next steps. 3 out of 4 people with bladder cancer have cancer that is confined to the first layer of the lining of their bladder. Of these, many people may not need any further treatment other than their initial treatment of the TURBT. They will, however, need regular internal camera checks. Some people may need a course of treatments in their bladder, usually instilled via a catheter. Rarely, some people with high-grade cancer that has not gone beyond the first layer may need an operation to remove the whole bladder. 1 of 4 people may have bladder cancer that has spread to a deeper muscle layer and beyond. Treatments will depend on many factors, including the cancer type, stage, and a person's overall fitness levels. Where the cancer has not spread elsewhere, treatments may include radical surgical removal of the whole bladder or radiotherapy. Some people may receive chemotherapy before and or after their surgery or radiotherapy. Chemotherapy uses drugs to kill cancer cells or stop their growth. It can be given before surgery to shrink tumors, after surgery to prevent recurrence, or as the main treatment for advanced bladder cancer. Radiation therapy uses high energy rays to target and kill cancer cells. It's often used in combination with other treatments or as the main treatment for people who cannot undergo surgery. If your whole bladder is removed, your consultant will also create a new way for your body to store and pass urine, known as a urinary diversion. As you can tell, there are many treatment options for bladder cancer. Your consultant will work with you to understand the best treatment option for you. What is the recovery time for bladder cancer surgery? Recovery time for bladder cancer surgery can vary depending on several factors, including the type of surgery performed, the stage of cancer, and your overall health. It's common to experience some discomfort and occasional pain in the days immediately following your surgery. Your medical team will provide pain management options to help you feel more comfortable. The timeline for returning to normal activities will vary depending on your treatment. You will need to take it easy and be gentle with yourself for the first few weeks or longer when you get home. In some cases, you might need physiotherapy or rehabilitation to regain full function and mobility, particularly if the surgery involved removing your whole bladder. Everyone's recovery timeline is different, but your healthcare team will ensure you are given all the information you need. Are there support groups for people with bladder cancer? Absolutely, there are support groups available for people with bladder cancer. These groups can provide valuable emotional support, information, and a sense of community for people and their families facing bladder cancer. Support groups offer a safe and understanding environment where you can share your feelings, your fears, and experiences with others who are going through a similar challenge. This can be reassuring and comforting during your bladder cancer journey. Can you live a normal life with bladder cancer? Yes, you can live a normal and fulfilling life while managing bladder cancer and getting treatment. Making certain lifestyle changes can help improve your quality of life while living with bladder cancer. A balanced and nutritious diet can strengthen your immune system and promote overall well-being. While it might seem counterintuitive, it's also essential to stay hydrated. Proper hydration can help reduce your risk of urinary tract infections and promote better bladder health. Physical activity tailored to your abilities and energy levels can enhance your strength, reduce fatigue, and improve your mood. Ask your doctor for exercise recommendations that suit your situation. So there you have it, a run-through of what bladder cancer is and what the treatment options are. If you would like to discuss bladder cancer in more detail and which treatment option is right for you, you can book an appointment with me or search for your nearest consultant online via circlehealthgroup.co.uk. We hope you found this video useful. Thanks for watching and don't hesitate to leave any questions in the comments section below.